Now, it's not only morning sickness and back pain that pregnant women have to endure throughout their pregnancy. Not endure, it makes it sound awful, endure, might have to put up with. What about the lack of nutrients in your body, or if you suffer from asthma? Or is it okay to take your inhalers if you do suffer from asthma? With us this morning to give us a rundown on what medication and nutrients mums-to-be can take is midwife Margaret Merrigan-Feenan and mum-to-be Alison Canavan. Good morning to you both.
Good morning.
Poor Ali, you're getting kicked black and blue.
I am indeed at the moment, yeah, my ribs.
And besides that, you were, and this is why we're doing this actually, you've had asthma all your life. Well, since you were about 10, haven't you?
Yeah, it got worse when I was 10. Like, you know, we started medication, really. I've always had a wheezing cough since, my mum said, since I was about 2. So,
and a while ago, you got sick.
A couple of weeks ago, I came down with a sinus infection and a throat infection, and I was urged to take antibiotics, which I did not want to do during my pregnancy, but I was, you know, told that they were safe to take, because I think you were saying as well, the most important thing is for it not to go into my chest.
Well, yes, when you're slightly compromised with asthma, it will be one of the things that we would be checking for and looking out for. So in somebody else, they might have got away without it, but when you have an underlying condition, it would be up to the doctor to make a decision whether they're giving you antibiotics.
So whether or not you take medication is based on whether you have a pre-existing health issue, to a large degree.
It certainly would be influenced by it. And the doctor would obviously have listened to her chest and looked at her throat and made the decision based on that.
And I suppose going into labour as well, I don't want to have a weak chest, because breathing, I presume, is of utmost importance during labour.
I'd say so.
The other night, so I'm nervous enough now as it is. The whole relaxation, Alison, is kind of going out the window at the moment, I have to say.
Mothers everywhere going, finally, she cracks.
Yeah,
she looks too good, she's too chilled out.
I had pains the other night, and
really?
I just lay in bed saying nothing for an hour going, oh my God, if this is it, I don't know if I'm ready to have a baby, but like, what choice do I have? I have to have this baby in the next couple of weeks.
Nervous?
Yeah, so I didn't realise that.
That's totally natural, Margaret.
Absolutely, absolutely. And any of us would be like that, because your first... when you get to Alison's stage, about 37 weeks, every little thing you have, you think, is this it? Is this it? And you can wind yourself up ever so slightly. But hence, that is where you do draw on the breathing and relaxation to calm yourself down and then assess the situation.
OK, well, let's just call up a graphic of the pre-existing medical conditions. So we've got epilepsy, asthma, diabetes, all of these kind of things. Basically, go to your GP.
Well, they would be the main ones, because those people probably have been on medication. So if they're planning a pregnancy, obviously it would be good advice to chat to the GP or to the
particularly
midwife.
with a lot of epilepsy medications.
Well, you see, that's it. But it would be wrong advice to come off any medication without consulting your doctor, because you could trigger an attack, whether it be the asthma, the epilepsy, or problems with your diabetes. So you must always consult your doctor if you have a medical condition.
And they've actually upped my steroids for the past 2 weeks, my steroid inhaler, one in the morning and one in the evening, to try and, you know, make sure that my chest stays healthy.
But they've reassured you that that'll cause no harm to baby?
Absolutely no harm to the baby, which is my major concern. With any medications, because you really can't take anything at all during pregnancy. Like, you can't just pop esophageine like you usually would if you have a headache.
Well, there should be no self-medication of drugs in general in pregnancy. But if somebody had something like maybe a head cold, maybe a headache associated with that, you could perhaps take the 2 paracetamol. But the worry is, if we say that, somebody would take 2 paracetamol every 4 hours for a week, and that's totally wrong.
Best to stay away from it if you can.
It would be on a once-off basis, and try with natural remedies to see could you clear the head cold with your vitamin C, your extra fluids.
And your diet.
Yes, and keeping yourself healthy during pregnancy.
Well, let's talk about that. Let's talk about nutrients in your diet. We've got a graphic just to call it up. The things that you should be on. And folic acid, I was surprised at that, because I didn't think you took that throughout your pregnancy, but you said yes in your diet.
Well, in your diet, yes. We would normally like women pre-pregnancy to take folic acid and then to take it for the first 12 weeks. But after that, you can continue it in your diet. You're going to get folic acid in your green leafy greens. Yes, your spinach and your broccoli. And of course, iron and vitamin C is of huge importance. The iron, you need the extra iron for the extra blood for the baby, etc. And the vitamin C helps absorb the iron from the diet.
Alison, can I ask, are you taking one of those like pregnant care supplements, or are you getting them from your diet?
I'm taking a supplement, and my iron was very low. At about 4 months, my iron got really, really low, so I had to take Golfer iron supplement, which did really help.
Is that most pregnant women would take a supplement? Would they, Margaret?
And
for the iron,
they say to stay away also, just a tip, tea and coffee in around 30-40 minutes, because it actually inhibits the absorption of the iron.
That's right.
So I was taking in the morning my iron tablet with my cup of tea, which was like basically a waste of taking a tablet.
So, good tip.
Yeah, it's much better to take the glass of orange juice. And
the vitamin C allows for the absorption, doesn't it?
And then the vitamin D is huge at the minute, the vitamin D and the calcium, because we are even finding in Ireland that some babies now are presenting with rickets. So it's really important that we get the vitamin D in the diet, and that the baby is supplemented for the first year with vitamin D drops. Okay, Margaret, I'm going to fly through. The last two graphics are about having tummy bugs and head colds, which is, we touched on that earlier on. So if you're sick, if you've got a cold or if you've got the flu and you're pregnant, and Alison said, you're thinking, I can't take anything, I can't take anything, what can you do? Tummy bug first, what can you do? Well, try and take fluids. And try and take some extra rest. And plenty of TLC from whoever is around you always helps. But a lot of women try to keep working, and really resting the body will rejuvenate it and kick-start it again, as it were. Yes. And the colds again? The head colds is what your granny might have done. Plenty of hot drinks, vitamin C, rest, maybe even steam inhalations. If you have a mild fever, again, maybe the two paracetamol. If that's not working, in other words, if it continues for a next day or two, then you would seek medical advice. Or if the temperature goes higher or remains up, you would seek medical advice. Ali, you're all better now.
I am indeed, yes.
You are all better now. And a little bit nervous, but that's okay.
A little bit nervous,
yes. A little bit nervous. Well, you're looking well on it, Mrs.
Thanks a million.
And Margaret, thank you very much. Great advice there, and great tip about the tea. That was very good, very interesting.